Gentlemen, let me ask you something straight. Have you noticed changes in your performance after 50? Maybe your erections aren't as firm as they used to be. Maybe stamina has dropped, or you're not recovering as quickly. Well, you're not alone. Millions
Of men over 50 struggle with this. And while most think the solution lies only in pills or supplements, there's another powerful tool hiding in plain sight. The right kind of stretching. Yes, stretching. As a urologist, I can tell you that the body's flexibility, blood flow, and pelvic health have a direct impact on your sexual performance. Today, I'm going to share with you 5 doctor-recommended stretches that can dramatically improve blood circulation, boost pelvic strength, and help restore harder erections, even after 50. So, stay with me until the very end, because not only will I walk you through each stretch step by step, but I'll also explain the science behind why they work. And trust me, once you understand this, you'll never look at exercise the same way again. Pause for engagement. And by the way, if you're new here, make sure to subscribe, because we talk about men's health, performance, and confidence, topics no one else is explaining this clearly. Main body, section 1. Why erections change after 50. Before we dive into the stretches, let's quickly understand the why. Why do erections tend to weaken as we age? The truth is, erections are all about blood flow. Think of your body like a plumbing system. If the pipes are tight, stiff, or blocked, the water pressure drops. Similarly, if your blood vessels lose flexibility or your pelvic muscles weaken, erections become softer. After 50, 3 big things happen. Reduced blood circulation due to stiff arteries. Weaker pelvic floor muscles that fail to keep blood trapped inside the penis. Lower mobility and tight hips which restrict the arteries feeding the pelvic region. That's where stretching comes in. The right stretches open up blood flow, release tension, and strengthen the pelvic floor, all of which directly support firmer erections. Section 2, stretch number 1. The hip flexor stretch, unlocking blood flow. Let's start with one of the most important stretches, the hip flexor stretch. Why? Because tight hip flexors are a silent erection killer. Sitting for long hours shortens these muscles, compresses blood vessels, and reduces pelvic circulation. How to do it? Get into a lunge position with one knee on the ground and the other foot in front. Keep your chest upright and slowly push your hips forward. You'll feel a deep stretch in the front of your hip and thigh. Hold this for 30 to 60 seconds per side, breathing deeply. Benefit. By releasing pressure in the hips, you open up the arteries feeding the pelvic area. More blood flow equals better erection quality. Think of this stretch as unlocking the pipes. Hook transition. And trust me, once you start doing this daily, you'll notice not only better erections, but also less back pain and better posture. Section 3. Stretch number 2. The seated forward fold, improving arterial flexibility. Next, we have the seated forward fold. This yoga-based stretch is a favorite among urologists who recommend natural approaches for male performance. Why it works? This stretch lengthens your hamstrings and lower back, which are directly connected to pelvic circulation. It also helps relax the nervous system, lowering stress, which, by the way, is another big erection killer. How to do it? Sit on the floor with your legs straight out in front. Inhale deeply, and as you exhale, reach forward toward your toes. Don't worry if you can't touch your toes. Just go as far as comfortable. Hold for 30 to 60 seconds. Benefits. By stretching your posterior chain, you reduce stiffness around the pelvic arteries, improving flexibility and allowing smoother blood flow. That's like giving your vascular system a tune-up. Section 4, stretch number 3. The pelvic bridge stretch, strength plus stretch in one. Now, let's add some power to the mix. The pelvic bridge stretch. This isn't just a stretch, it's also a strengthening move for the pelvic floor, which plays a key role in erections. How to do it. Lie on your back with knees bent and feet flat on the floor. Press your heels down and lift your hips toward the ceiling. Hold for a few seconds, squeezing your glutes and pelvic muscles. Slowly lower down and repeat 8 to 10 times. Benefit. This move strengthens the pelvic floor muscles, the same ones responsible for trapping blood in the penis during an erection. Stronger muscles mean harder, longer-lasting erections. Imagine it like reinforcing the dam that holds water in place. Except here, the water is blood, and the dam is your pelvic floor. Section 5. Stretch number 4. The butterfly stretch, opening the groin. The butterfly stretch is a classic, and for good reason. It directly targets the inner thighs and groin muscles, regions rich with blood vessels that lead straight to the genital area. How to do it. Sit on the floor, bring the soles of your feet together, and let your knees fall outward. Hold your feet with your hands and gently press your knees closer to the floor. Hold for 30 to 60 seconds while breathing deeply. Benefit. By stretching the groin, you're reducing stiffness around arteries and nerves that directly influence erection quality. This stretch is like clearing the main highway of traffic, making sure blood gets to where it needs to go. Hook transition. And here's something you'll love. Men who add this stretch often report not only stronger erections, but also improved flexibility in the bedroom. Literally. Section 6. Stretch number 5. The cat-cow stretch, boosting nerve plus blood flow. Finally, we come to the cat-cow stretch, one of the most underrated moves for men's health. Why it works. Erections are not just about blood flow. They're also about nerve health. Tight, lower back muscles can compress nerves that control pelvic function. The cat-cow stretch releases this tension. How to do it. Get on your hands and knees in a tabletop position. Inhale, arch your back and lift your head. Cow pose. Exhale, round your back and tuck your chin. Cat pose. Repeat for 1 to 2 minutes, moving slowly with your breath. Benefit. This improves spinal flexibility, nerve function, and pelvic circulation, all essential for strong, reliable erections. Think of it as a reset button for your nervous system. Section 7. How to put it all together. Routine for maximum benefit. Now, let's put this into practice. Here's a simple daily routine you can follow. Hip flexor stretch, 1 minute per side. Seated forward fold, 1 minute pelvic bridge, 8 to 10 reps. Butterfly stretch, 1 minute cat-cow stretch, 1 to 2 minutes. That's less than 10 minutes a day. Gentlemen, think about it. 10 minutes a day to reclaim confidence, vitality, and performance. Isn't that worth it? Conclusion. So, there you have it. The 5 best urologist-approved stretches for harder erections after 50. Remember, this isn't about chasing quick fixes or relying only on pills. This is about taking back control of your health naturally. Every stretch you do improves blood flow, strengthens muscles, and supports the very foundation of your sexual health. If you start today and stay consistent, you'll not only improve your erections, but you'll also feel stronger, more flexible, and more confident in every part of your life. Now, I want to hear from you. Will you commit to trying these 5 stretches for the next 30 days? Drop a comment below and let me know. And if you found this helpful, don't forget to like, share, and subscribe. Because here, we're building a community of men who refuse to let age define their strength and performance. Gentlemen, your best years aren't behind you. They're ahead. Take the first step today.